I know, but we're waiting for a clerk. Okay, I'd like to call the Personnel Committee meeting. Courtesy of the floor, is there any from the public? Seeing none, our next item is review the county executive appointment resolution of the Area Agency of the Aging Advisory Council. And that would be Georgia Ciani C., 227 Burdette Street, Wingate, PA, 18091. Ms. Ciani is being considered for a term to begin October 25th, 2024, to end June 30th, 2026.
Move to the agenda.
Okey-doke. Any other business for personnel? Seeing none, we'll adjourn and go on to finance.
I'll call the Finance Committee meeting to order. Any courtesy of the floor? Seeing none, then we'll go ahead and move to the first item, review of the controller's reports. Controller Zirinsky, you're up.
Can I close this? Is that okay? Okay. So I just wanted to update you a little bit about what's going on in the controller's office, in addition to our reports. I've been involved in planning the joint conference, which is at Lehigh County. Executive McClure will be giving the opening remarks there. That's very exciting. And this is part of the 16 CPE credits that not only we will be getting, but also other county controllers and their staff will be getting. The second day of the conference is at DeSales University, and so we will be working to update ourselves on fraud, accounting procedures, SAS 145, new Yellow Book standards that are coming out, as well as other auditing topics. Okay, so great. Our first report, want to make sure I'm in order, is Magisterial Court, District Court 0303-01, Judge Robert A. Hawk. The scope of this audit is focused on the statement of changes in assets and liabilities, cash basis for Magisterial Court, as mentioned, for the fiscal years ending December 31st, 2020 to December 31st, 2021. The opinion, the auditor concluded that the financial statements are accurate and fairly presented in all material respects following the cash basis of accounting. The basis of the opinion is the audit, as all other subsequent audits that I'm going to talk about today in terms of the Magisterial District Court was conducted according to the generally accepted auditing standards in the U.S. and government auditing standards by the Comptroller General. The auditors confirmed independence and sufficient audit evidence to support the opinion. The auditor's responsibility aimed to provide a reasonable but not absolute assurance that the financial statements are free from material misstatements caused by fraud or error. The procedures included risk assessment of misstatements, evaluation of internal controls without expressing an opinion on their effectiveness, examination of policies, estimates, and overall presentations, and for ensuring compliance with going concern standards. The conclusion is the report confirms that the financial statements accurately reflect the cash basis transactions for 2020 and 2021, and the audit was conducted thoroughly and in compliance with required standards by Mark Diliberto, who is an Auditor 1. Our second Magisterial District Court 03-2-04, Judge Alan Medge, Esquire, examined, again, the statement of changes in assets and liabilities on a cash basis for the fiscal years ending December 31st, 2021, and December 31st, 2022. The key findings were internal control over financial reporting. The audit assessed internal controls to determine appropriate procedures, but did not provide an opinion on their effectiveness. No material weaknesses were identified, though unidentified weaknesses might exist. A significant finding noted involved approval processes for voided transactions. The first observation was in 3 of the 10 voided receipt transactions tested, approval by the magisterial district judge or a second clerical technician was missing. Additionally, 2 other voids were not approved at the time of the transaction, but were approved later. Multiple interoffice policy memos required timely approval of voids, but these policies were not consistently followed. The recommendation was that clerical technicians should obtain immediate approval via initials or signature, but by the MDJ or a second technician when voiding receipts to ensure proper oversight. The management's response, Judge Alan Medj, Esquire, confirmed that copies of the relevant policy memos have been requested and will be reviewed with staff to ensure future compliance. I actually accompanied Mark Diliberto on this and was able to complete some of the testing with him, and so it was very interesting to see how the process of the audit went and just to interact with the judges. The Magisterial District Court 03-201, Judge Roy A. Manwaring II, Esquire, again examined the statement of changes in assets and liabilities for cash basis for fiscal years ending December 31st, 2020 to December 31st, 2021. The financial statements were fairly presented in all material respects using this cash basis of accounting, and the conclusion was that the audit confirmed the accuracy and fair presentation of the financial statements. This again was completed by Mark Diliberto. Now we're going on to the hotel. Hotel tax, Holiday Inn Express, Cherry Lane, license number 127. This audit covering the period from January 1st, 2022 to December 31st, 2023 involved agreed upon procedures to evaluate the accuracy and timeliness of hotel room rental remittance tax by the Holiday Inn Express, Cherry Lane. The audit was conducted according to generally accepted government auditing standards, and no opinion or conclusions were expressed beyond the agreed upon procedures. The remittance of forms, the hotel used the latest remittance forms and completed them accurately. There was one issue, 6 out of 24 remittance forms were submitted late, with late fees assessed in only 3 instances. The hotel failed to submit the required exemption reports for 8 months. In the accounting process review, the hotel's accounting process was reviewed and found sufficient to support accurate tax remittances. Discrepancies were found between the hotel's reported taxable room revenue and their financial records. 8 months of revenue was understated, 9 months of revenue was overstated, and the exemption validity testing showed in a sample of 48 claimed exemptions that were tested, 34 exemptions were valid, 10 exemptions were invalid due to missing tax-exempt certifications for non-permanent residents. The conclusion was the audit was limited to agreed-upon procedures and no opinions were expressed of the completeness of the findings, but the hotel owes Northampton County an additional $396.44 in unpaid hotel room taxes. This was completed by Florina Tang, our Auditor 1. The second hotel room tax is Home 2 Suites, True in Easton, the license number 163. This reviewed the hotel room rental tax remittance for periods January 1, 2022 to December 31st, 2023. The objective was to assess the accuracy of the taxes collected and the remittance of Northampton County under 2 operators. Because the Home 2 Suites by Hilton was sold on December 12th, 2023. So operator 1 was Central PA Equities, LLC, as part of the Springwood Hospitality, and operator 2 was High Hotels Limited, and that's after December 12th, 2023. So the key findings, both operators used the correct remittance forms and calculations. They were correct for 24 out of 25 reports. The operator 1 submitted 8 late reports, but late fees were only assessed for 2. Operator 2 submitted the December 2023 remittance on time. Both operators failed to use the county's detailed exemption forms for all 25 reports, instead providing only supporting documents. Operator 1 failed to report $49,164.79 in taxable revenue by omitting pet and smoking fees. Operator 2 remitted correctly with no discrepancies found. In the exemption review, 21 out of 50 exemptions tested were valid. Operator 1 had 14 invalid exemptions due to missing tax-exempt certificates, and 11 invalid exemptions due to missing documentation of 30-plus day stays. All 3 exemptions tested under Operator 2 were valid. The conclusion was the audit identified significant issues under Operator 1, including late remittance, underreported revenue, and invalid exemptions. Operator 2 demonstrated full compliance following the property sale and owes no additional taxes, but Operator 1 owes a total tax and penalties due of $4,088.95. The next one is Candlewood Suites in South Bethlehem, license number 160. Again, this reviewed the period January 1, 2022 to December 31st, 2023. It assessed the accuracy and timeliness of tax collected and remitted to Northampton County. The hotel used the latest remittance forms completely and accurately, and all remittance forms were submitted on time, and tax collections were correct for all 24 months. The hotel failed to submit the permanent exemptions form for September of 2023. The audit confirmed the hotel's accounting process was sufficient to ensure accurate remittances, and the hotel consistently remitted the higher amount of tax collected versus tax due. A sample of 50 exemptions were reviewed, and all were found valid. However, 12 of the 50 exemptions were miscalculated, though validity of the claim was upheld. In the conclusion, the Candlewood Suites Bethlehem South complied with most requirements, including timely submissions and accurate tax calculations. Minor issues, including missed exemptions and miscalculations for some exemptions, yielded a tax owed of $145.46. That was also completed by Florina Tang, our Auditor 1. Woodstone Country Club and Lodge, license number 144, examined the rental tax remittance for January 1st, 2022 to December 31st, 2023, evaluating the accuracy and timeliness of tax collections and remittance to Northampton County. In the key findings, the remittance form review showed that they used the latest version of the forms completely and accurately. Taxes were calculated correctly for the entire 24-month period. 3 remittance forms were submitted late, but no late fees were assessed by the county. The audit confirmed the hotel's accounting process was sufficient to ensure proper remittances, and the hotel consistently remitted the higher amount of tax collected versus tax due, and no exemptions were claimed by the operator during 2022 or 2023. So Woodstone Country Club and Lodge complied with the county's tax requirements with accurate calculations and timely submissions for most months. Minor issues included the 3 late remittances without late fees assessed for a minor tax underpayment of $24.73. This again was completed by Florina Tang. And finally, we have the Grand Estonian Suites Hotel, the license number 135. This was audited for the period January 1st, 2022 to December 31st, 2023, focusing on the accuracy and compliance of tax reporting and payments to Northampton County. The hotel did use the latest version of the remittance forms completely and accurately. All remittances were submitted on time. The hotel consistently remitted the higher amount between tax collected and tax due with accurate calculations, and the operator's accounting process was found to be sufficient for accounting tax remittances. The audit found discrepancies in taxable revenue reporting, understated taxable revenue in 5 of the 24 months, and overstated taxable revenue in 7 of the 24 months. Out of 50 sampled exemptions, 8 were invalid, resulting in additional taxes owed. The Grand Estonian Suites Hotel generally complied with the tax regulations, but had some inconsistencies in taxable revenue reporting and exemptions, resulting in a minor underpayment of $53.91 that it owes the county. This was performed by Auditor 2, Altene Kenneth Beckhoff. And that concludes my report. Any questions? Thank you.
All right, next is the discussion regarding Greystale private pay rate changes. Anybody from Greystale talk about this? Okay. There's a resolution, I'll read the resolution just for discussion. Resolved by Northampton County Council that effective January 1, 2025, the Greystale private pay rate for a semi-private room and board rate shall be $370 per day, and a private pay room and board rate shall be $380 per day. And the 15-day hospital bed hold rate shall be $285 per day if expressly elected. Further resolved that any resident in the short-term rehab unit who stays beyond their insurance coverage shall pay a private pay rate of $600 per pay. I don't know if we don't have any information as to what the rates currently are or the motivation for the increase.
Not entirely.
These pay rate increases are put forward by Medicare and Medicaid. So when those amounts go up and those rates change, since we charge a new rate and county council has to approve those rates and revenues, we put them before county council.
So these are driven by Medicare and Medicaid and
Yes.
not
Correct.
internally?
No.
Okay,
And-
thank you for the clarification.
The rate increase is $10 per day.
Any other questions on that topic? Okay, thank you. Next, a review of the 2025 court cost increases resolution. Anybody from courts to discuss increases? Any other background on this from? And on this one?
There's an attached document that includes a court order, and it's basically just a requirement that we pass the resolution in compliance with that court order.
Compliance with the court order, okay. Any questions on that from council? Okay, we'll move that. Next item is discussion regarding bond financing ordinance. It's a new ordinance to be introduced. Anybody from the audience on this one?
So currently, the bond ordinance has been tabled by Northampton County Council. Due to the requirements Mr. Warren brought up that he would like to remove it from the table, most practicably, some of the language in there, specifically with relating to the times we hit market and things like that, are needed to be changed. So as opposed to doing that with amendments and whatnot, a new resolution has been put forward. Council doesn't have to do anything more if it so chooses to introduce it, which we would highly encourage you to do. The next meeting would be the public hearing on this November 7th. And at that point, we would have all the advertising done. It will be passed to Mr. Spinoni. Bond counsel is handling all of that to make sure that we are in compliance with the Department of Community Economic Development. I also have Garrett here from PFM. You heard from Mr. Scheer. Garrett is one of Scott Scheer's counterparts. If there are any questions related to this particular introduction to the ordinance, Garrett is here to answer those questions, and I am here to answer any questions you might have about the scope of the bond or anything related to what we're looking to use the funds for.
Steve, what was the response from the administration when I presented the $6 million building on 248 inside of the Easton County seat?
While I appreciate that, I looked at that building and some of the buildings elsewise. Now, it wasn't on the market when I was looking at it. I don't know how it came to market. Don't know if there are leases in the building or any of that other stuff. The bottom line is, for the 30,000 square feet, we cannot move elections statutorily out of the city of Easton. And if you've been downstairs, you see the need for more space and more open space specifically for those functions. Also, accessible space. It's very difficult for people to be standing for long periods of time. We're lucky enough, fortunate enough to have benches for people to sit. So while, you know, that is potentially an idea, we haven't entertained it. Other than to look to see what was out there.
Or when this gets introduced and then we discuss it, because there's not a lot of desire on this council to spend $63 million for a wish list for the county. So unless you guys are willing to say, hey, what else can we do, you might just get a flat no. I'm trying to think outside the box, and every time I think outside the box, you guys tell me, no, you're wrong, you're wrong, you're wrong. So, all right, if I'm wrong, then it's either yes or no on the $63 million bond, that's it, I guess.
Nobody in this administration is saying that we have a parking capacity problem at the moment. We did years ago, and that was solved when we constructed the new parking lot on Wolf Avenue. We do not have a parking capacity problem. We have a parking, the condition of the deck is the problem. It'll be 50 years old next year. Every single report I read says you can expect 40 years out of it. We've already done 3 or 4 major repair projects on it. How much further do you possibly expect that structure to be extended?
That thing's taken care of. It's concrete. It could last 50 more years. Concrete bridges, concrete buildings, they last as long as you maintain them.
How do you maintain it? Are you going to be constantly replacing the rebar that's encased with it
No.
after 40
No, you're not
years
gonna
of
replace it,
de-icing
but
salts?
you can't allow water to be getting in between the floor deck, so when the caulk joints fail, you have to recaulk it.
Yeah, and that's exactly what we did this past year. But the damage is already done. That rebar has already started to corrode. We cannot keep just kicking this can down the road.
I think it's a matter of beginning to maintain it more aggressively, because yes, it's a $20 million parking deck that we can't just say, well, we use this one up, let's throw it away. We can continue to maintain it. And that's my opinion.
Were you
And I
provided
understand
a
you guys
copy of
have your
this
opinions.
report?
I saw it.
Did you
yes.
read it?
Yes. Mr.
So, just really quickly, I've actually seen the rebar.
Mm-hmm.
I've actually seen some of it corroded where it's separated. I've seen that. This garage is going to become dangerous, not just to our property, which is significant because most of our sheriff's vehicles are stored, housed in that garage, but to the potential personal injury if someone were to be in the wrong place at the wrong time. It needs to be fixed. It cannot
Agreed,
be.
it needs to be
It
fixed.
cannot, no, it needs to be raised and rebuilt. It cannot be fixed. It had a 40-year life, 3 engineering companies, 3 different ones. 2002, what was that, 9 or 8?
2008.
And when was the last one we did? 3 different companies have said the life of this
If I
thing
got a
is 50
professional engineer to
years.
come in here and say, and give us an exact scope of how to fix it, would you respect that engineer's advice?
No, because
Exactly my point.
we have plenty of information. It is okay to oppose borrowing money. That's fine to say no, but you're not entitled to your own facts. And the facts are that this parking garage is no longer safe. It's no longer
My
safe.
answer, Ms. McClure. I
I
appreciate your
got
time.
it,
Thank
but
you.
it's no longer safe.
Well, actually, Mr. Amelia, I had contacted Mr. Amelia after our last meeting to talk about this, after you had presented, Mr. Goffredo, your concept and plan. I was going to ask if your concept and plan had prevailing wage with regard to, I believe, the 8 million. And also the fact that, as I've mentioned many times, the parking deck it's a public safety hazard. And I don't want to rehash what the county executive just said or Mr. Amelia just said. And it came to my attention in speaking with a former employee of the county, I believe back when the structural engineering was initially done in the early 2000s, that there aren't footers underneath the parking deck. That is a huge issue. It's a huge problem.
You know what a footing is?
I do. I used to work for a
when
civil
you-
and municipal
When you're
engineering
on
company.
bedrock, that is your footing. The
Yes,
bedrock
I
is your footing.
understand.
Okay.
I understand. It's still an issue. When I ran for this office last year, and I'm going to agree with you on something, not one individual that I was going to within various communities in my district, going door to door, and I was talking to folks on their front porches, not one person said, you know what, I'd really like to have this bond. But I came here to this council and have been working with the administration, communicating with them in a manner where we want to get the most responsible public policy initiatives done for our residents. Whether it's a parking deck, whether it is new office space, whether it is whether it's the LEAP program that we just learned more about. A bunch of different initiatives that I wasn't particularly campaigning on last year, but have been now brought to my attention. And quite frankly, if our experts in the administration say that we absolutely need something, then I'm going to ask questions, as I have done. Mr. McClure will tell you, I've asked him a number of questions. Mr. Amelia, I've asked him a number of questions about this. They're saying that we need this for our county government to run effectively and efficiently in the future, and I am going to take them at their word on this. I will take them at their word.
And Mr. Warren, I don't want to sound like a contrarian, but it is literally our job to make sure that if there's a check for any opinion of the administration, we are it. So,
Absolutely,
yeah,
I
I
agree.
understand. I want to go along when I agree with the administration, but if I disagree, I got to voice that. Whether I get made fun of or called out on TikTok, whatever. I have to deal with that. That's fine, but it's still my opinion that the county and the taxpayers, more importantly, would rather see government do a little less. Maybe we don't open up a hospital or a medical center in our county building. Maybe we stick to what we should be doing, which is collecting taxes, running a courthouse, running a jail. And if we are running out of space, maybe we do a little less. That's my opinion, and it's okay to have a disagreement. We don't need to make fun of each other for it. We can have differences of opinions. And when it's all said and done, whoever votes for one way and votes for the other, that's
I
the way it
haven't made
goes.
fun of you about anything.
No, I know, but some other people of
Okay,
your opinion are.
I know we're
I
having a
agree.
conversation.
I'm sorry. I'm talking to you, and you have not made fun of me. You've been nothing but professional. So, yes, I have a disagreement. I think we can make do. I think we can take care of what we have, and I think we can end up having a perfectly safe parking deck for our employees. And that's why I think Mr. McClure and Mr. Millie both park their cars under the parking deck, because it is relatively safe. Yes, it needs to be maintained. Yes, we need to continue to maintain it. And there are upgrades that we can do, major upgrades, not a couple $100,000, but we could probably make $1 million upgrades and completely redo the exterior facade, completely coat the concrete, re-caulk, new doors. We could really spice it up without spending $20 million. And I think
There
that's
have
the
been
big thing.
investments made, though, correct? There have been investments made over the past few years.
As there will continue to need to be as the structure stands. You have to continue to take care of it, always, absolutely. And yes, eventually the life will run out, but right now, as I see our federal government blowing through money, burning debt, state governments doing this, we get that money from them. I want to make our tax or our financial dependence on them a little less. I don't want our budget to go from $350 million in 2015 to $550 million in 2024. Like, we are spending a lot of money. I want to spend less. That's my prerogative. I don't have a nefarious intent. I don't want to be a roadblock. I just would like to spend less money. So when I see opportunities to do that, I would like to take advantage of it. When the correction workers come in here and say, hey, we need to get paid more, that's where I think we should be focusing our money. I think we should be focusing on the employees in the county to make sure that goes a tremendously long way. And I don't think building a medical center in a new office and a new parking garage is the best way to spend that money. And nobody can come up here and tell me differently. I'm a hard no on it. I've heard enough about it. I'm a hard no.
In terms of my advocacy for this, Mr. Goffredo, you just mentioned our county employees. And we have county employees working in closets. Ms. Wondolowski? Ms. Wondolowski? I mean, when I was on the advisory board for children, youth, and families years ago, I was hearing about that, quite frankly. It's been going on for some time.
Do we have more employees than we did 5 years ago? Like, dramatically more employees? Because everywhere I see vacancies.
Caseworkers continue to, it's a cycle. When I was on Children, Youth, and Families Advisory Board, it was a topic of conversation a lot. It is a
And we're talking
cyclical
about
thing.
expanding the elections office, which since 2020, I understand, we're doing elections differently.
It's a good idea.
But here's the thing, I don't like the way we're doing elections anymore. I think we have problems with our elections.
know
It's
you
like,
said that.
differences of opinion. But when I'm hearing Philadelphia saying, hey, it's gonna take us 4 days to count the elections, it's like, yeah, these things, I don't think they're improvements. I think having single-day voting and doing it at the polls and getting it done,
There's
I
going
think
to be
that's
more
improvement.
transparency, I think, with regard to our elections office. We're going to have more transparency. We will. Greater space. I mean, there is going to be a window where folks can actually look in from the outside to be able to see what is happening. You know, there's,
I get it, but like I'm saying, the premise, the whole reason what we're talking, I don't want to make it easier to vote 4 weeks. I want to have voting on one day, Election Day, at the polls, like it used to be done for the last 250
that's a debate
years.
for another time.
I know,
too.
I know, but
So-
like all of the premises of what we're doing this for, I'm not in favor of. Like, I get it. If you want to have a health center, you need somewhere to put it. Well, we could put it in the new building we build. I don't want a health center. So all of these things, Mr. McClure, do you have something to say? You can address the microphone.
Where did you get the notion that if a health center were to be established, it would be in the new building?
We haven't been told where it would go.
No one has talked about that. And
Well,
as a
it's
matter,
on the agenda tonight.
well,
so
no, but
I've
no one's
found it-
no one's talked about putting in the new building.
I'm just saying, it'd be a
and
convenient place.
nor would we. That's not what we've contemplated. So I can put your mind to rest tonight about that particular issue. And additionally, there's no money contemplated in the bond for the health center either.
I've heard it before. Money is fungible, right?
Yeah, not in a bond, though. I mean,
I
if
get
it's,
it,
if
but-
it's not delineated in the bond documents, you can't move that money to that particular activity. So there's no money in the bond for a health center, and we wouldn't put the health center in our new building.
Thank you for the
I
clarification.
heard that twice. I just wanted to make sure.
I know we're going to disagree. I know we're going to disagree, and it's okay to disagree. And I'm not sitting here trying to convince you, Mr. Goffredo, to vote in favor of this, because I certainly know that you're not going to. I want my constituents to know why I'm doing this. I'm doing it to enhance our services, because I think Mr. Heckman says it continuously. We are a service-based county government. In the services that we provide, you know, we have to keep up with the times. You know, this isn't the 1990s anymore. This isn't the 1980s. We do have to keep up with the times, even if that means our infrastructure at times needs to keep up as well.
And I don't want to drag this meeting, I know it's a long meeting. You're right, we have to keep up with the times. But everything different isn't always better. I'll just leave it at that. So we can make changes, and sometimes we make changes like, ooh, that wasn't for the best. So there are some things that I think, you know, just because we did it, doesn't mean it was for the better. And I do think that we offer great services here at the county. But I also think there are some services here that are, you know, there's chinks in the armor, and we need to shore up. So I think we need to focus on what we do already. I think we need to allocate resources to make sure that the services we provide are as the best we can be. That's all. I'll leave it at that.
And I will segue right to that. On this hand, we have workers who are complaining they don't have enough room to work. These people are professionals. They deserve a workspace. They're working out of closets, and you deny it. That's one thing. So on this hand, we have, what can we do? We want to be the best, you know, do the best for our workers. We want to pay them more on this hand. But on this hand, no. We don't want to give you the workspace that you deserve. Then, on this hand, you want, what can we do for elections? Let's create an elections integrity committee. Okay, what do you need? How can we help you? And they say, we need more space. We're working out of 4 different spots, which is not the gold standard for elections. But on this hand, we're going to say, no, we don't want to provide that space for you. Okay, then, you know, you have 3 engineers that came and gave reports. You have professional people who have researched, investigated, done their due diligence, came here and said that this was the best thing that they could come up with. And then you come and say, I made a few phone calls. I could do better than that. What would it take? How many engineers would it take for you to actually believe it. What would it take for you to believe that people aren't working out of closets? If you had a doctor that gave you 3 recommendations and you had to, God forbid, something was wrong, not you, somebody else, just hypothetical, would you sit there and go, no, I'm gonna make a few more phone calls. I think I could do it better. No, you wouldn't. These are professional people that did the work, put the time in, and you just continue to say, nope, that's not it. No, that's not it. We need to enhance our services. We need to provide a professional workspace for our employees. We need to make our elections the best they could be. And this is what the administration is coming out with. And for you to deny almost everything, it's mind-blowing. That's all I gotta say.
There's people working in the closets and I was wrong about. I apologize.
Financed through bond issuance. They are almost never paid for out of tax revenue collected today, because what would happen then is a tax increase would be implicated. And we don't want to raise taxes. Taxes haven't been raised here during my administration. In fact, they were cut in 2022. And when we close the books in February, we'll look to see if we can cut taxes again. So no, you go out into the market to borrow money and spread that risk out over generations so that you don't impact unnecessarily and unfairly the taxpayers of today. So the answer to your question is no, and that's why.
Okay, thank you.
But wouldn't it be cheaper if you didn't finance it? And if you knew 5 years, when did you say you guys had the first engineer come and say the parking deck needed to be replaced? 2000.
2002,
Okay, so that was 22 years ago.
yes.
And I know you weren't executive back then, but
22 years, no, I was not in county government 22 years ago.
I'm just saying, what is our fund balance? Like, so do we
Well,
have?
so, when the books, we'll know in February what it's going to be. I predict it will be somewhere in the high 20s. Remember, a fund balance is what's left of the budgeted money that didn't get expended by the end of the year. It isn't, for example, the stabilization fund. But I suspect it'll be in the high 20s. But I wouldn't, Mr. Crevedo, I just wouldn't pay cash. I mean, it's municipal government 101 not to do that.
For $63 million, I understand that. If there was a more affordable plan for a parking garage and you could afford it, I would say what you spend in the interest over the life of that loan, it would be well worth it to save the taxpayers the money over the life of that.
Well, so if, in fact, council does not pass the bond issuance such that we can't raise and rebuild the parking garage in our office complex, I will do everything in my power to make sure that the garage doesn't deteriorate to such a condition that it becomes a danger and we have to close it. Unfortunately, sometime in the next few years, it's going to need to be closed, and we are already making contingency plans what to do with our parking and our vehicles when it does close for safety reasons.
How many square foot of office do we have currently here? Not including the courtrooms, the courthouse?
Good question. We'll need to get that answer for you. But what?
Somewhere around 30,000 square foot?
Well, what we do know is it's approximate to what we'd be moving there.
Right, like we're doubling the size of the office building in this building. So that's what I'm saying. So you guys are giving us one option, and it's a Cadillac. You have anything else?
Well, I don't agree it's a Cadillac. I think it is
60 million.
pretty much.
That's a lot of money in construction. I know you're doing more than just building with that.
Well, remember, we're building it for the rest of the century, though. I mean, people.
Parking
people
garage lasted 50 years. You're
people-
gonna tell me this is gonna last 100?
Well, we're in what, 2025? So most of the rest of the century, anyway. The good 50 or 60 years, the new construction is, I think, anticipated to last. And that's not my estimate. That's the estimate of the engineers and the builders.
You're a better salesman than me. I'm a terrible salesman. That's why I can't convince people like them to disagree with me to come on my side. But I am a realist, and just like I know that parking deck, because that's what we have to do it all the time. There are times where you can't destroy things, and you have to find ways of fixing them. And I know you guys did the girder strengthening with the steel, and you did recalking, but there are more things that could be done, and that's what we have to do sometimes. If you said, hey, for $5 million, we could do a new part, or for $8 million, no new office, because right now, or a smaller office, if you showed us something else, but $63 million or nothing, I'm a hard no on that. You give us something else to look at, maybe we could consider something else, but we are not getting a lot of options here from the administration.
I understand your point.
Thank you.
And just to follow up on your
Sure.
your point, Mr. McClure, municipal government 101 financing is not something I necessarily agree with, and not how I approach my time in office. I do believe, like anything else, you can reserve monies, you can do set-asides. We do it all the time. That's what some of the fund balances are. We do it for certain programs. They're set aside, they're not spent sometimes for years. So just to point out that it's a philosophy and an approach your administration has taken, not one that I necessarily ascribe to.
So when you were contemplating building the new jail out of Graysdale, one of the things you did do was have the P3 concept added to the state law, so that if in fact you were going to build a new jail, you might be able to take advantage of that type of concept. But certainly, that kind of expenditure and the hundreds of millions of dollars that you were contemplated you'll agree with me, would have required some borrowing of money.
Actually, that whole approach is a very complicated financing model. But I did set aside, for example, the $14 million for the Human Services Building, which is that for the county to be able to purchase it. So over the time I was in office, I was able to set aside that $14 million for that eventual purchase. You chose to do something else with that money. So there are examples that it can be done. It's fiscal management 101, and it is a philosophical approach.
Yep, and, you had a tax increase in your first 4 years, and I haven't had one yet, so, see how that all works out.
Any other questions on the topic?
Yeah, can we ask the controller what she needs for her building? I mean, we are running out of space. Tara, can you come up and tell us what conditions you're working under?
In the beginning of the year, when I first became controller, I approached maintenance, and we had a list of concerns. I had a broken window in my office. There's no ADA compliance. Apparently, Tony Basile, when he was controller, had wanted ramps put in to make it compliant. There's no way to make this building compliant. We have security issues. We don't have the luxury of having the entryway that the courthouse does. And anybody can walk into our office on the second floor and walk through the doors. We asked for security key cards to come in and out, but we still have to keep the door open so that people who need to access us, because we don't have another employee sitting downstairs to let people in or to even answer a buzzer. So there's the accommodation issues. We had to create an office out of the break room for one of our employees. That break room also serves as the server room, so that employee has a server mounted on the wall in her office. We had to get a special desk to fit into that area made because it was just an odd shape. And we still have a bathtub in our office.
Mr. Rinsky, you're in this job for 10 months now?
Around there. But I also have to say there are a couple other issues that are structural. We asked for the facade to be done, and there was some work that was done. They drilled through the facade, and it's kind of like this foamy sponge board, and underneath it's wood. So the wood underneath may or may not be rotted because they just went straight through it. And that is what I heard from our maintenance people. The septic system was just worked on, and that septic system is tied to the adjacent property. So when their septic system gets backed up, we get the
We're not
odor.
on sewer, Mr. Emili? Really?
Yes, so we have to deal with the odor.
Mr. Rinsky,
To
my
back
point
up.
is, I've never had, I haven't been involved very long, but 2.5 years, Mr. Bucky never came in and said there was any issues. You added employees when you started as your controller. You said I needed people, right?
We
And
have the
said
same amount of
Okay,
employees.
then how did they make do for so long? And now all of a sudden we have all these problems. Everything's falling apart. Nobody can get around. We're working in closets.
Because I have taken the time to make sure that my employees have a safe and clean environment. When I went there
You
in
don't
the
have to raise your
beginning,
voice. You can just talk in a normal volume.
sure, but when I came to that place, the walls needed to be painted, there were ceiling tiles that were out. It was in a kind of dilapidation. Our maintenance workers have worked to do deep cleaning on that, to get the mold remediated, to get the bugs out, and because we had a bee problem, and also to make sure that our offices are on the second floor so that the first floor does not have to endure the odor. And that is what I've been able to do to try to make my employees in that office happier and safer.
Fair enough. So if you want to leave the office, I'm assuming, to go to a new, what would you suggest we do with the office if you leave it? Just abandon it? Or should we fix these issues that we have?
I'm not quite sure you could, I don't know, I'm not an engineer, I can't tell you whether or not they can be fixed, but I've been told that the building, if it were to transfer, would not meet code. You could take a marble on the floor and it will just, it's not level, there's a lot of structural issues with it.
I'll have to stop by your office, I guess, because these sound very,
I have pictures from before of what it looked like and pictures after. So I'll be happy to give you a tour of the office.
The greatest joy in my life as controller, because I sat where Tara sat, was when Ron Angle sat in the chair in front of me in the desk, and the cabinet on the crooked floor was like leaning, and it looked like it was going to fall on Ron Angle. That used to give me so much, like, little bit of laughter.
because it was Ron Angle?
Yes. But it was, the floors are crooked. She is correct.
Yeah, I
Calm
mean,
down.
that's not gonna give me joy, but I just wanna say that I think there is an effort to improve the accommodations that we provide our employees and the conditions of their workspace, to make it safe, to make it clean. And I think one of the reasons why the building in itself couldn't be remediated is because of the ADA compliance. The ramps would be too expensive. There's no place to put a ramp, even if you wanted to, and even to get on the second floor, there's no way to get somebody who would need accommodations to get to the second floor.
Mr. Millie, is that your opinion too?
We looked extensively into making the entrance to that building ADA compliant. The problem is there's a staircase and a raised platform, probably about 4 feet off the sidewalk where you enter the building from. And in order to construct an ADA compliant ramp, it literally extends past the edge of the building because you're only allowed to drop so many feet in slope. There's no room. The sidewalk's like 5 feet wide there. We looked into that as well, and it's very expensive.
Not $63 million expensive.
It's not impossible, but
That's my point, and this is exactly what I do for expertise. This is my job, and people call us, say, hey, we can't figure out a solution, and we find solutions, because a lot of people like to say, nope, you gotta knock it down and build a new one, and then you can pay me to build a new one. But that doesn't usually work for everybody with limited funds. Now, we're a government, so it feels like we have unlimited money, but it's not unlimited, and I just wanna make sure we're being conscientious of that.
if the controller's office was the only problem we were trying to solve,
I hear
sure,
ya,
by
I
all
hear ya.
means, but.
And
it's
Mr. Millie,
one
if
of-
you showed me something that was maybe half of that, $30 million, 35, 40, I would probably say, hey, but $63 million bond, 40-some million dollars worth of building, it's a lot. It's a lot. It's 12%, 14% of our budget. It's a
we
lot
have-
of money.
We have pointed out before, too, we are being very conservative with these cost estimates. They're based on the estimates that Skanska gave us that were conservative. We think the construction costs will likely come in under that. If there are savings to be had, Any additional, millions that are left over could be reallocated to capital projects at the jail or elsewhere and would just take less of a burden on our normal annual budgets.
And the only reason why I have a problem with that is Mr. Brown was saying, we're financing that money, we're paying interest on that money. So, yeah, it's like when you buy a house, you're like, oh, well, I'll buy the furniture too. Do you really want to spend 20 years on a couch? Or you just want to buy that couch that you need right away outright instead of paying interest on it? Yeah, we need to do stuff at the jail. It's like, yeah, but we have money in our budget. We could shift things, we could pay for that stuff. The things that we desperately need. If we need a project where we need to finance, let's make sure we're not spending more than we actually have to. And it's like, I don't want to limit the county from getting what it needs, but you got to be able to give us an option that maybe is an option B, maybe an option C. If you only give us option A, yes or no, like I said, I'm a no. And I feel like I'm beating this to death, so I guess I'll stop at this point.
Just a question. For the controller's office, or whoever wants, what is the square footage you need to properly accommodate your employees in a professional environment that's conducive? Are we looking at, 800 square feet, 2,000 square feet? What would we need? So maybe 2,000 square feet,
Yeah.
right? And the controller's office has never had to be attached to this building. So a 2,000 square foot office space is readily available in the market close by, so you're not traveling 20 miles, but down in the city of Easton for, I think you had even indicated, on average $16 a square foot. It's basic professional office space, desks, some computers. It's not a big retrofit. So why hasn't that option been explored and recommended which would you could probably solve your issue tomorrow, next week, 2 weeks. I'm sure you could get a lease done in a heartbeat and transition your team within 30 days or less and be out of that particular building.
That's not for me to
No,
decide.
I'm
Yeah,
not
that's fine.
asking you,
Yeah,
to.
I get it.
To Mr. Gafredo's point, that is another solution that has not been brought forth
Mm-hmm.
as part of the overall concept of building the building, so.
Yeah, I'm neither for nor against the building
No, that's
or
okay.
the bond.
I
I'm
wanted
just
to
telling you
understand
about what our
All
building
I
is.
wanted to understand was really what you need to accommodate, as you said, your employees in
Mm-hmm.
a professional work environment to get the work done that you need to do on behalf of the county.
Right, but I'm only one person, and there are many
Okay, but
individuals who
I'm
need
addressing
accommodation.
your particular
Sure.
office needs in this conversation in the moment, so.
Sure, and I just want to add why I don't, again, I'm not a professional, but the chairlift, I do not think would work due to the fact that the stairs are curved in the pitch, and even so, you'd have to somehow get a wheelchair up to the second floor if necessary.
Yeah, Tara, without me looking at it, I'm just throwing ideas at Mr.
spitballing.
Miller.
I get
Yes.
it.
So
I get
honestly,
it.
I'm sympathetic to what I would love to come see it. But if this is the justification for building a new building, it's just not enough for me.
I don't think it's the I don't think the
One of many,
controller's
I
office
guess.
is the only justification. It's
one of a
elections,
couple,
it's
yeah.
human services, economic development, it's.
garage.
And I'll talk to you maybe, I don't want
That's
to
fine.
air this in the public, but it just seems like whenever something's a wish list, all of a sudden there'll be 4 or 5 people lined up to tell us why it's such a great idea. And it's like, yeah, I get it. They want a new office. I don't want to spend $63 million. I could care less. Yeah, I want them to have a new office too. If it was free, I'd say, yeah, put it in. But we got to pay for it.
So, Mr. Gafredo, no, you are not a salesman, and you're not an engineer either, okay? You build things, but you're not an engineer. We have 3 engineers that came back and gave us their opinions. I am not interested in disjointed solutions. I'm not interested in that. I am interested in the employees and treating them like professionals. I am interested in enhancing our services, and I'm interested in our taxpayers' money and being conservative. We have a conservative county executive. We have a conservative, Mr. Barron is conservative. These people work for the county, and they are professionals in their jobs. I don't understand why we think that we could do their jobs. You guys sit up here and you offer all these solutions. You act like you guys could do their jobs. They get paid to do their jobs. And so they have the advice from engineers. They have done their investigating. They have put together a plan for us. And I just want everyone to know that I am for the employees. I am for the taxpayers. I am for enhancing our services in the long run, not just now. In 75 years, I am interested in keeping everybody safe for the parking garage, and I am not interested in putting a Band-Aid on gaping wounds, because this is what this sounds like.
Any other discussion on the matter? No? Yeah, okay. Then we'll close the conversation on that and move forward to the discussion regarding Employee Health Center RFP. Mr. Barron, I guess this is you again?
It is before you. We have an Article 13 contract. We put out an RFP. We had a committee. We invited 2 council members. Our committee got together. We reviewed the contracts utilizing the same metric we had before. And the overwhelming winner in that process was Integrity Healthcare. There's been a lot of discussion about, how the employees feel about that. There is the Article 13 contract is going to be before you tonight. But I wanted to take a moment. Mr. Henritzy is here from AFSCME, who represents the largest portion of our membership. And he wanted to just share some of the things related to the health center. And as he comes up, I wanted to say that we had our meeting with BSI. We are looking at that $30 million number that I projected, about a 5% increase, 5.7% increase overall, 19% over this quarter. Now, the end of the year, some of our costs come down because of a lot of the treatments we have are in the middle of the year and front-loaded with some folks.
Steve, just clarify, BSI and...
BSI
5%.
is our consultant for healthcare. They're the ones that go out and help us negotiate our contracts with Capital Blue Cross. And, we had actually looked, and we're saving a few $1 million by the way we are handling our prescription medication with the employees, trying to make their HSA dollars go further by using Express Scripts through a vendor we found through the County Executives of America called HISI. That has been working very well to stave off the actual inflation that's going on in healthcare. But we need to do more. And Mr. Henritzy is going to talk about why the employees are for the health center. And then, I have Mark Colligwire here from in Integrity. He will be glad to answer any of your questions. The Article 13 contract is the exact same contract that was before County Council before. That would be a two-step process. The 2 steps would be, approving the contract and then selecting the location, and council would have the ultimate approval as they do with any leases. The county executive and I have talked about this. We believe leasing is the best way to go. Working with this company for 5 years, as they're saving money elsewhere, it would be a good way for us to get into that model, see how it worked. There's no additional cost. The budget contemplates this. It is listed in the footnote of your budget, primarily because the funds that we would pay to Integrity for the care they provide outside of their management agreement for the health center would be money we would spend anyway, but instead of sending it to St. Luke's Hospital, Lehigh Valley Hospital, we would be giving it to Integrity because they're providing that health care at a lower rate. But Dennis is here. He wanted to give a brief statement, and then we'll answer any questions you have.
I think it might be afternoon yet. Yeah, it's still afternoon. Good afternoon, Council. My name is Dennis Henritzy. I live in the county. It's 4154 Ross Road in Bethlehem Township. And I just wanted to speak a little bit about what we did, what we are as Local 1265. We are the biggest union in the county at the present time. Right now, I've increased our membership to over 450 members in AFSCME Local 1265 under District Council 88. Our feeling is we had Mary Lou Caboli come up and explain the healthcare center at one of our meetings. She did an excellent job, and just to certify that no wool was being pulled over our eyes by administration or by anybody else, she explained it indefinitely, and our members, my sisters and brothers in our union are all in favor of it. As you all know, the healthcare costs are skyrocketing throughout the county, throughout the country, and there's no way out of it. They're going to skyrocket. Prescription drugs, we have a very good plan. Co-pays, we're very good on that. So physicians trying to get an appointment, I just had to cancel one appointment back in September. It's March of next year before I can get another appointment. So this county health facility that we're going to try to get through would be very good. This administration has secured a very good health plan with the addition of Teladoc and the CanRx program. With this in mind, the Partnership Health Center would enhance current health plans that we now have in place. The benefit to our sisters and brothers would also reduce their co-pays if they do get sick, all right? And being able to increase productivity inside the work area. You get a coworker that's sick, they go home, that puts an extra burden on the staff that's there. So where they can go to a health center that's for Northampton County employees only would enhance that. They might be able to go there, get back to work, not take 2 or 3 days off before they get an appointment with their private physician. So with this, all this reason in mind, Ask Me Local 1265 is still fully supporting the health center for us. If you have any questions about us and support, I'd be more than glad to answer it for us.
Just clarify for council where the membership works within the county.
Oh, we're throughout the whole county. We're up at Graysdale, in here, the whole county. That's where our membership works.
You said full support. Everybody's total, everybody in the whole union?
Everyone that comes to the meetings, yes, we have full support. Yep, 100%.
Any other questions for? Mark, do you want to come up and?
I don't have a formal presentation for you. I mean, obviously, you've seen me before, and we've had a lot of conversations. I'm really, was asked to comment if you have any questions about the way the health center operates, the way we operate. I'm here to answer them. But, I mean, we've been doing this with y'all for a long time, and, I know you've gotten a lot of information and data and reams of paper, so I wouldn't want to bore you with more. But I'm here, so if you have questions, and I'll be back there if there's, I don't know, if Mary Lou, are you speaking, or is this is it?
And
Okay.
I would just, I know there's another agenda item for Article 13. We put this on as sort of a separate item. I would ask that you move the Article 13 contract to the full agenda so council can decide it up or down as a whole. That's all I would ask of this committee. Thank you.
Mr. Barron, really quick, you and I have had a number of conversations about this particular issue since I've been on this council. We're going to end up saving taxpayer money, correct?
So yes.
I just want to be
yes,
on
we
the
are, we are
record
going to
saying
be,
we are
we're
going
going to
to
be
save
saving
money.
taxpayer money because ultimately, and I'll give you the easiest example. I go to I get a sick visit. I go to an urgent care it's attached to, let's say, Lehigh Valley Hospital, because that's where I go. That urgent care appointment costs me my copay, which is, I wasn't on the HSA when I had county insurance. I'm with the city of Allentown now, but I have a copay. I pay that copay. Okay. With an employee health center, okay, and after that copay is paid, the county pays out of the healthcare trust fund. We pay for that appointment. Say that appointment costs us $200 plus the copay. So now we're at $225. Now, let's say that person is sick, they can't get into the urgent care, they don't want to go in there, but it's closer for them to go to the employee health center. The $25 stays in the employee's pocket. That visit now costs us pennies on the dollar because we already have the health center there. That person sees the doctor, they get treated, they get their prescription, maybe with an agreement we're hoping to work out with HISI and the Express Scripts, they can get their medicine right there at the health center. If that happens to be an antibiotic that is stocked at the health center, if not, they get their script, they go home, they're treated right away. And it costs us, out of that trust fund, $100. Now, we have saved $100. The employee has the $25 back in their pocket, and then that ultimately saves the taxpayers because we are trying to stave off the cost of that inflation. The other thing we hope to do with HISI, with Integrity, they have their green circle of folks where they provide referrals, as well as, we talked about this, and this is something that I really like, someone is struggling with their medical bills and what copays they have to pay and where they're at. Integrity is looking at the overall health of an employee and will help organize those bills, explain the program, and talk about with that employee where they can come to the health center if need be to save money, and where they need to go to the doctor, and how they can best work through some of those medical expenses, especially in a catastrophic situation like a cancer treatment or whatever.
Can
Sorry.
I add
Yeah,
something?
go ahead.
You know I can't help myself, right? Mr. Warren. So, I mean, again, I know we've talked about this before, but we save money in a couple of ways. One of them, which Steve talked about, is delivering the services at a more efficient way. Right? In one place, in a more efficient way. So that doctor visit that someone might have, instead of it, costing $1,000 ultimately, right? It ends up costing $700. It becomes a fixed cost because you've got the health center in place, but it's delivered in a more efficient way. But the other thing is also care coordination. And I know we've talked about it. Doug Forrester's been here with me. The idea is to make employees healthier and coordinate the care, because I guarantee you, like every place else we deal with, has employees who are seeing 5 different doctors and has a lot of different medicines, and the coordination is just not there. We do that. We have a person on staff who will coordinate the care for your employees, to presumably get them healthier, and thereby reduce costs for the county, because you're self-funded, right? Those are checks you're just writing every month. That's the way it works. There are other ancillary benefits. I mean, obviously, if you have a health center nearby and people can get to in and out quicker, we do have same-day appointments everywhere we operate for people, which is really, pretty great. Good luck trying to get a same-day appointment with your doctor, tomorrow. Anyway, I'm sorry to jump in.
No, that's okay. I wanted to answer your question.
It seems win-win situation. Taxpayers win,
yeah.
employees win.
Is there any guarantee that it will save money?
I know you've asked that a number of times
And the
before.
only reason why I'm reiterating is because, A, they weren't here the first time around, and I don't want to make every argument that I made in the past, because unless anything changed, I don't think my position changed, but
I don't expect yours
so
to change.
is there
But
any guarantee?
There's no guarantee. I mean, but the way we operate is we don't guarantee a return, and there's a really good reason why too. I mean, because first of all, as we've tried to make really clear, this is not mandatory for the employees. Right? We want them to come, because the more of your employees who actually use the health center, the greater the utilization, the more money the county health plan saves. Right? There's a really easy way to cut the costs. If we're operating, and if we weren't ethical, and we would just cut back and skimp here and there, right? We'd make sure it saves money by cutting back on services. We don't want to do that. We want it to be a first-class facility for your employees, so they are incentivized to use it, and they will get healthier, and you will spend less money. It's worked everywhere in the last 15 years where we operate. So can I guarantee it's going to work? I'm pretty darn sure, based on the track record we have. But the answer to your question is no, we're not going to guarantee a return, because we then would have a conflict of interest.
Let me ask you
Think
this
your employees
question.
or you want that.
There's so much to it. I remember last November, I was in Florida, and writing a long email. I believe I was asking you the questions. I had a lot of in-depth questions about it, because I was very intrigued by
I
the
think you spoke to
concept.
Doug Forrester, the
Maybe
chairman
it
of
was
the company.
Doug.
Yep.
And unfortunately, the reason why, initially became sour to the idea is because the answers I got weren't as precise as I was hoping for. And I was hoping for some really, since you guys have experienced this before, I was hoping for really in-detailed answers. My main concern is this is a supplementary option. You still have the option. So, like, I don't go to the doctor very often. I try to stay healthy. I don't get sick, but I had to get 6 surgeries last year. None of those would have been able to be handled by the health center. That's a specialty item. And they're also very, very expensive.
It's apples and oranges, though, sir. I mean,
But the
we're
most
not a
expensive
surgery
items,
center.
the most
We're-
expensive items on your health care plan, if you have cancer, you need to get chemo. If you have diabetes, and you,
We are not going to replace cancer doctors
so
or
you
surgery
still
centers.
have to keep the big services. Not to mention, I have spoken to a lot of, because this has been a year long. I disagree with the 100% employee commitment to this because I've spoken to a number of employees who wish to remain nameless because they don't want anybody to be mad at them for not going along with it, but they don't like mixing work with healthcare for privacy reasons, for, you know, the fact that we do have very good health services in this community, and people like their doctors.
I can
They
only
like
tell
their
you
family
from
doctors.
track record of 15 years of our company operating, that yes, people have raised that in the past, and
And I understand, so that brings up
we
my
do,
third
we
point.
do have to operate under HIPAA.
I believe you're going to get utilization. My question is, do you think the convenience is going to increase the likelihood that if somebody has a tickle in their throat, they're going to go down to the health center and create an occurrence where,
You know what, honestly, I want them there. I want
sure.
them there.
And
No,
I think
want-
that's kind of the, healthcare is a business.
No,
and-
because we don't get paid another penny if they show up.
But I understand, my point is, healthcare is a business, so usage is important, and getting people to be encouraged to come in. So I'm just saying, there's a lot to untangle here, and I can't say for sure if this is gonna be a saver or more expensive. All I know is we have to pay you a fee every single year on top of our insurance that we already still have. And then if we start divulging into where we buy x-ray machines, and we have all the equipment that comes with being in the medical industry, it can get expensive
Wouldn't want you
quickly.
to have all the equipment in the medical industry.
Not
We-
for-
We
not-
do, the x-ray machine is in the budget already. I'm
Not for
sorry.
nothing, this isn't your first rodeo, correct?
No, and I would encourage you, I mean,
And-
we've, in the RFP.
You have done this before, correct?
Yes, yeah, yeah.
Do you have
Never
clients
lost a
you've worked
client.
with that have saved money in
We
the
have, and
past?
we've given you guys the information and phone numbers for a number of people who would vouch for this, business administrators and county administrators who'd be happy to speak with you about it.
Mr. Barron, out of all 67, 68 counties in Pennsylvania, how many have health centers?
No, no, well, our only client is Lacombe.
No, not just Integra, all the counties in the state,
I
how
know-
many have health
I know of
centers?
about 2 or 3. Now, the
So I
integrity
just want to make it,
model-
we would be an outlier here. Yeah, maybe Mr., I'm sorry,
Calaguire.
Calaguire has a successful program someplace, but this would be an outlier program for this county.
Now, to be
That's only-
clear, those are counties of our size. So Pittsburgh, they can utilize their public health department, and they have employees that go to their public health department, as does Philadelphia. So when you look at some of those larger counties that say they don't have it, or I'd say they don't have it. Now, also Lehigh County has a health center. However, that health center is run on a very, very different model. So we are looking at the integrity model and what they've done in Somerset County, New Jersey. Their one client, Mark, where's your client? Is it Luzerne?
Lycoming.
Lycoming,
County,
thank you. It's
Williamsport,
an L. I knew it was an L. I always get the Luzerne, Lackawanna, Lycoming confused. So, and these, in Somerset, I know they've done emergency management services, so volunteer fire companies and such, and they've expanded it to the school district of Somerset County. Now, we don't necessarily need to do that, obviously, but one of the things to have this service for our employees and to stave off money, this year, healthcare will cost $30 million, period. Tad over that. We still have the stop-loss insurance, that stuff is baked in, but it doesn't need to cost that amount of money. And, you know, I don't want that to be the budget buster. That's why I'm bringing innovative solutions to try to make sure the workforce stays healthier, and it costs us less money, because we talked about being a good steward of taxpayer dollars. If I didn't present these options to county council for the county executive, I would not be a good steward, and I wouldn't have lasted the decade and a half I've been here.
And I would encourage you, again, his name is on the RFP response, especially Matt McDermott, who's the chief of staff in Lycoming County. I mean, he really knows this stuff, and their experience has been really positive, and he offered to talk with any of you guys. I think someone did speak with him. Yeah, you did speak with Matt? Okay. Anyway, I would encourage more of you to do so, because I think he really knows his stuff. And Executive McClure did remind me of something. So we've told you, we've put in writing that, we'd be willing to negotiate give back of part of our management fee, which again is separate and apart. You all understand that. If we don't hit certain metrics, in terms of just visits and things like that, but that's different than, cutting costs or guaranteeing a return on investment.
That's part of this. That was when it was submitted this time around. Mark submitted basically the same contract with that guarantee, which we felt would help county council get around to, letting us try this, as well as, now what we did is, inflation, you had the extra year on the end, so we cut off the first year out of the year at the end. That's the difference in the contract from what you guys.
I just want to make sure that I'm being clear, because I know so we are not going to, we can't guarantee a return on investment, okay? But I just want to make sure you don't think I'm now changing my, but I am saying that we feel confident that you're going to hit the metrics in terms of visits and utilization that you need to make sure you save money. And I think you agreed, there will be utilization. I mean, it's the way it always works with all of our health centers. Employees love it because it's convenient. Honestly, I wish I had a health center where I could get same-day appointments and the kind of service they're going to get. But anyway.
Questions? Go ahead.
So, again, on one hand, we want to save the taxpayers' money. We don't want to spend a lot of money. We want our employees we want to retain our employees. We want to treat our employees as professionals. And we're given a solution, and no, we don't want to do that. This is all I say. I was here when he first started because this is one issue that I ran for this seat. So I've been watching this since the very beginning. This is a solution to save our taxpayers money. It's a solution to save our employees money. It's a solution to make our employees feel valued. It's a win-win all around, and I am for it. I would love to do it, and like I said, this was one of the number one reasons why I ran for this seat. I would like to see this happen.
So I would
Yes,
ask county council, if you don't mind, just to move it forward for,
We're not
entire
done yet,
council.
Steve.
unless
Jeff,
you
go
have other
ahead.
questions.
Projected cost of lease of the building, retrofitting the building, renting of the equipment, and the fee for integrity year one.
So what was the management fee? So we have the $700,000. Now, for the lease and build out of the building, that depends, Mr. Kapoor, and here's what it depends on. It depends on if we find office space, like medical office space that is already retrofitted for a medical office. Obviously, the build out wouldn't be as large. Then maybe we would have to make the determination what it's going to cost to build out. It is. So there's also on Baglio's Circle. So
Well.
not two spots. So if we build that out. Now, the other thing we can do is, depending on the cost, we could come to county council and we would present this plan to county council. County council, we have the ability to do a lease this way where we factor the build-out cost into the lease. We pay that capital lease over a period of time. It will most likely be a triple net lease, even though I don't like them. Triple net lease will probably be what we do, and we finance that out over the time. So for the build-out, and the property manager or the person who owns the building then gets that cost back plus the triple net on the lease.
But by the way, anytime we go into a place, usually the staff gets a little nervous because they're thinking they're going to do all this themselves, right? So I just want you to know that what we do is we provide pretty much a turnkey operation. So we will go and find the space for you. We will hire an architect. We've worked with one in Pennsylvania in particular who I think is very good. But we would recommend them. We'll get it done for you. So Mary, will you? Always welcome. Our history has been, probably the build-out and the cost, maybe 1% of your total healthcare spend. So, and again, like Steve said, if you finance it, because it would be an improvement, I know I've heard the bond discussion, but it would be on an annualized basis, relatively small in the scheme of your healthcare spend. We recommend that on purpose, because we want you to see the savings right away, and we want it to work.
So it's hard to give you the exact price on the outfitting of the building, but the great part about every other person besides Integrity was an exception in this when we went through the RFPs, and Mr. Giovanni was part of the first one. They're the one, their management fee, that $700,000 in the first year, that includes the consultation. So once the contract is signed, that includes everything leading up to getting that building up and running. So-
We have a crew that does that. They'll stay on top of it, obviously with a lot of input from your staff.
Yep.
And Tom, go ahead.
The trust fund pays for that, but they have the appointments there. And ultimately, you talk about billable hours for doctors and patient care hours. My wife was a manager at Lehigh Valley Hospital. We want to make sure we get people in the door. If that doctor's working, they're working on a cheaper basis than we would pay through Capital Blue Cross to a St. Luke's or Lehigh Valley Hospital. That's where the savings is. That's where that ROI is.
I don't know if I've said this
I
before.
don't mean
I'm
to cut
sorry.
you off, but wouldn't you agree, when you're not at St. Luke's or Lehigh Valley, you're not paying for the doctor? So it's like, we're always paying for the doctor.
No, we are, because there's a doctor in an emergency room, and if you walk into that emergency room, you pay for the fact that doctor was sitting around.
You understand what my argument
your
is here.
point's-
I
Once
understand
we
your
open up a
argument.
health center, we have
Your
employees that we're
point's a good
paying.
one.
Yeah.
Your point's a good one. You've taken what's a variable cost, right? You're in business. You're taking what's a variable cost, because if somebody goes to Dr. Smith, they don't pay no one pays Dr. Smith until Dr. Smith provides the service. I understood completely. You've turned into a fixed cost where now we've hired Dr. Smith or some other doctor as our medical director for your health center. That person is on salary. You're absolutely right about that. But again, over 15 years, what we've found is that saves you money, because Dr. Smith is a fixed cost, and Dr. Smith sees patients, and you're delivering it in a more efficient way. So your point's a good one. I understand it.
You have anything else?
I'd prefer I'd prefer they work for us and they get paid a little bit less money for those appointments,
Commissioner, actually,
as opposed to paying for Lehigh Valley or St. Luke's overhead.
what's actually been really interesting, you guys obviously all go to doctors and know the healthcare system. So primary care physicians, it's a tough business right now, because their reimbursements are lower. So my neighbor is a primary care physician. He happens to be mine, right? He works his rear off, because he's got to see X number of patients every hour, because the reimbursements are lower and lower every year. So we often get from the community that we open in a really good primary care doctor who wants to come in and be on salary and be able to take care of patients, make them better, spend as much time as they need to take care of people, as opposed to having to churn through it. So we always get some pretty darn good people. Right, but it becomes a fixed cost, like Commissioner Goffredo said, it becomes a fixed cost. And I understand your point. Having said that, it is always worked out that it's costing you less, because you're not paying for it someone on the outside it's much more efficient. And it has been. I mean, again, we have a track record on it.
Any other comment? Jeff? Go ahead.
If you don't mind, County Executive McClure, can I ask you a question? We've had a couple discussions over the course of 10 months that I have been here, and I haven't asked you something. Why do you want to do this? Why do you keep fighting for this, quite frankly?
Well, because I want to save $5 to $10 million over the next 5 years.
Straight up.
Yeah.
$5 to $10 million.
I've become convinced that that's what will happen. What?
It better be more.
Well, from being,
Better be
I was
more.
referred to as conservative tonight. I want to be conservative in my
I
estimates.
haven't asked you that question.
Yeah, no, I
because
want to save
you've-
$5 to $10 million.
Administration's
That's
been
my
extremely
motivation. I've
persistent.
become convinced we will.
Any other questions, comments? All right, Mark, just a couple comments. One, basically, when I took a look at this in depth, the current medical services that are being provided to the employees, already 90% are being provided for. I didn't see Integrity really adding anything but an incremental. Part of the challenge that I see with this is we're prepaying. We're paying you a hefty management fee. I understand the idea of the health center. But basically, what we're doing, we're prepaying for all those appointments and those doctors and those office visits. So it's not on our activity with Capital Blue Cross. So you're really taking the activity, which would go to the health insurance, and shifting it into this health plan at a fixed, supposedly a fixed lower cost price. The concern that I have with that is, with the prepaying, then we're absorbing all the risk in this process. The doctors, the cost of escalation of whatever is going on in healthcare today, short of your management fee, really is a pass-through and is uncontrollable necessarily by the county once it's in place. Once you have a doctor, you got to renegotiate doctor's fees, so on and so forth.
Can I make one just comment, Mr. Brown?
Sure,
So, no, this would be your health center, okay? So we never just do it on our own. In other words, so any cost, any changes, we'd want you to approve. So, for example,
No, I understand that,
okay,
I
just
understand there's a
those
dialogue. It's
pass-throughs,
not a,
right,
it's not
yeah,
a,
we're-
it's not a
yeah.
blank check. I'm not implying that it is, but whatever that would be is going to escalate over time and is a pass-through back to the county anyway.
Escalate over time.
Over time, doctor's fees, materials cost,
Well,
whatever that might be.
materials costs will
yeah.
go up anyway, but yeah,
Yeah,
again,
okay.
if
So
there was a
that's
doctor that we
part
need
of
to
the-
raise the salary for, you'd have to approve it. We wouldn't want it.
That's part of the point that I'm making with that. And currently, as I see it, the employees of this county already have a Cadillac plan. The healthcare plan that the county currently provides is one of the top ones that employees could expect to have. What doesn't get introduced into your plan overall is consumerism. And in the research I've done on the healthcare and when I was executive, the idea that the employees are not subject to consumerism, meaning I can go and get whatever done I need to get done, and the county's paying for it, whether I go to see a doctor that would be $100, or a doctor that was $300, it gets passed back through to the county. When you introduce the consumerism and you partner with the employees in that level, the numbers that Mr. McClure threw out about saving, we were saving that already without having to invest millions of dollars up front. So I do think there are alternatives that could be taken a look at that this administration doesn't want to look at.
Real quick, Mr. Brown, how
No,
are we
let me-
saving
Let me
that?
finish my statement, okay? Once, with the $30 million that Mr. Barron is talking about, those changes actually began when they changed the plan back in 2019. I think you changed the plan.
Yeah, but
which
co-insurance
then
on the back
started-
of employees,
Which then
ma'am.
started escalating costs right away. And
Yeah,
I've
but
done the
co-insurance
charts,
on the
I've
back
looked at
of
the numbers
employees.
over time, and that's an escalation that would, which leaves us where we are today overall. So I understand the concept that Integrity is trying to bring forward. I just think it's not as robust as it's being presented to be overall, and I think we could achieve things in different ways. Mr. Warren? go
Yeah,
ahead.
thank you. Mr. Brown, we are already saving 5 to 10 million? Is that I thought that's what you had just said in your
I
statement there.
didn't say that. No, that's the projection from the.
But that's the projection.
He was-
You said we were
he-
already
he
saving.
claimed-
During my time as executive, yes, we made changes to the plan, and we started saving $2 to $3 million in the following.
But it was out of the employee's pocket. There was co-insurance and things like that that he subjected them to and higher co-pays. So where he got that $2 to $3 million savings was from the workforce that he employed.
Actually, the savings came from the fact that the employees were now choosing whether they wanted to go to and select a more expensive doctor or go to a similar doctor at a lower cost. And that is fundamental to what the whole process is.
He charged a co-insurance at the end. Cost me more money. I was in the healthcare plan at the time. I felt it. And I actually was elected controller at a set salary, so it hit my direct pocket. I didn't get raises.
Any other questions?
I would just
comments?
ask the question, Mr. Barron, so you agree now that the health insurance plan that we have today is very, very good? It's a little bit more expensive than Mr. Brown's?
Oh, I've said it,
Would you say that we have one of the better, Capital Blue Cross is probably one of the best plans you could have?
So Capital Blue Cross for self-insurance, yes, is the most affordable and the best buy for the county taxpayer dollar at this time.
Makes sense to reiterate, we're not.
Yeah, and we're not replacing the
understand.
health insurance
And I
yet.
just want to say, I don't want it to come up, I think you guys keep falling on Integrity Health because you guys seem like an outstanding professional organization. The problem that I'm facing is what you're saying and what the administration is saying is flying in the face of logic in the sense that you're going to tell me that the government is going to be able to put together a savings program for one of the most expensive things in the market, which is healthcare, which is expensive because government got involved in healthcare. So fool me once, shame on me. Fool me twice.
We're private.
They're
Well, I know,
private,
but
yeah.
we're now teaming up and we're becoming this, it's almost like, quasi, we're
It's
this.
thinking outside the box.
And,
Mr. Warren.
and Mr.
Hey,
Gafredo,
listen, I like outside the box
Mr.
thinking,
Gafredo,
but once
we-
we get,
Just don't talk, just let John talk, you'll get your chance to
Mr. Warren,
comment,
I
please.
appreciate what you're saying, and I appreciate outside the box thinking, but this is not a small step. This is, can be almost $1 million a year plus probably $1.5 million startup to get going after you get the lease and the equipment and the building and the fit out. And then we're pot committed for at least 5 years. So if we don't save the type of money that we think we're going to save, and then all of a sudden it's like, now you start getting, it's a machine that takes over where it's like, hey, we got to maintain this, we got to do that, we got this guy. And it's like, we have employees now, we got doctors that are employees that we feel committed to. I don't know if I want to venture down that road. I think I want to keep the healthcare where the healthcare is and the government where the government is. And when you get sick, you go to the doctor instead of being the doctor. It's a
and-
philosophy thing. Could it save a couple dollars? Sure. Is our budget going to go down next year? Probably not. Like we're going to keep trending in the trajectory that we've been trending up for the last 15 years, upwards.
And Mr. Gafredo, just remember that we are a self-insured health plan. So we're not, okay, I just want you to remember that point. So there are many things we shop around. And this solution, when it came to us initially, we didn't bring it forward to county council because we still had other things to do. We shopped around our stop-loss insurance. We got a great rate on that. We have no lasers in that. And I'll explain to you what a laser is offline if you'd like to know. There's lots of different things that we've been able to do with our health care. And we still want to do more. We don't want to increase any cost to the employees because we want to make sure that they have great health care, that they want to keep working for us, and this is one of the solutions we're bringing forward.
Said something, I just want to make sure I'm just perfectly clear on it. The doctors, the nurses, they will not be your employees, and you don't want them as your employees. And the reason is because of medical liability.
You'll have the liability.
We
and
have the liability insurance. So that, just make it
And like
really
I
clear,
said-
you're not hiring these doctors you don't want to. It's our job.
You present I can understand why they keep coming back to you guys. You guys seem like if you want to go in this direction, you guys have a good product for it. Problem is, I don't want to go in this direction personally for philosophical reasons that just don't align with the logic that they're trying to go. If we want to save money, I think there are areas where we can save money. I think health insurance or our health care is very important. And I think I talked to a lot of employees. They gave me their input. I heard some that want it, some that don't. I think that's why we all get 9 votes, and we get to decide that way. I appreciate you coming here, and you've been very professional in doing so. Thank you.
I know the directions.
And council, you know my request.
Yeah, no, I just want to clear up, I do not want our county government in the business of providing health care for folks. Like, I'm with you, Mr. Giuffre. I don't want us hiring doctors, and that's not what this venture, I believe, is. I believe that at the end of the day, with the data that we've been shown, the fact that it's worked before, it's going to save us taxpayer money. Like I don't want us having Northampton County doctors or anything like that. I do not want that. That's not why I'm supporting this. I want to be clear about that.
Then I think it just simply comes down to, we both got to make a bet. We don't know which way it's going to go. We have to kind of trust our instincts. And I'm not going to disrespect your opinion. I just hope you don't disrespect mine.
2 other concerns that I have. One, in your presentation, and it's been repeated numerous times, that this is a voluntary program, right? And the savings is going to be dependent on, the utilization of it over time. One, even though it's being positioned as voluntary, I don't think it would be voluntary because I believe the administration of it is incentivized to force our employees into this center once it's created overall. The way this administration has dealt with our employees, at least from what I've seen and who I've talked to, overall, it's not beyond reason that they would be forced into using this facility against their concerns. And there's some of the employees are concerned about their records and their medical being commingled with the county employment.
I know that's one,
The
can I
oth-
just answer that, or no?
No, that's okay. The other concern I have is you threw out Lycoming as another, the council member from Lycoming was here last time you were here. I think one of the Lycoming people were here. But that program for the county, they've gone out and had to bring outside agency into that program also. They reached out to the city, I believe, to invite them in. So what's to prevent eventually this program going the same way? It's supposed to be dedicated to county employees, but as to Mr. Gofredo's point, once it's launched, typically governments don't close programs, you just keep feeding them over time. And 2, there has been challenges going forward that to reach out and open it up to other entities, other agencies that are not
Is that a question,
directly
or
county.
Can I
Oh,
explain
please,
that?
go ahead.
Okay, first thing I want to say is, we have never been involved in anything where it's been mandatory for the employees, ever. And we probably would withdraw if it became that. It's not our model. And quite frankly, if you built a health center and then made it mandatory for all your employees to use it, it would be overwhelmed. It's not going to happen, certainly not with Integrity Health, and I know that that's not what they have in mind, number one. Number 2, we encourage any of our clients, by all means, if there's a school board or if there's a city nearby who wants to come in after you've opened it up, and the employees agree with it, and the sponsoring entity agrees with it, do it, because it defrays the cost even more, as long as we can handle the volume. So Lycoming County, who was thrilled with their health center, and if you spoke to Matt McDermott, he would tell you that, they went to the local government and said, look, we have this facility, we do have space to accommodate you, would you be interested? They did it. And it helps them defray costs, they save even more money. So it's not nefarious, I mean, it's just, it's
No,
them
I
deciding
understand,
that,
I
it's not us
understand the
deciding that.
economies of scale, but
Sure.
throughout the current.
But the employees have to agree to it. They're not gonna be scattered.
Throughout this presentation and the prior ones that we've seen over time, that is a central theme, that this is only county employees, and yet you just gave a great example that over time, they could go, oh, economies of scale, yeah, hey, if we can double by bringing in some, we could lower our costs and so on and so forth, but then it's not the county employee health center anymore either, and that's a concern I have also.
Well, I would
that
assume
it'll
the
balloon
council
into
would have to
something more.
decide that. and
I
if you
understand,
don't
I
wanna do
understand
it,
the
you
whole,
wouldn't do
I
it.
understand the process of how that would move forward, but with that, so. Any other comments on the matter? Okay. Then, last we have is the Article 13. Where am I? The Article 13 contract. Review the Administrative Code Article 13 for Integrity Health. Any comments or questions? Okay, then I'll make a motion that we do not move this forward. I'm not in favor of it, so I'm going to put a motion out since Mr. Barron asked us to to move it forward to the general meeting. I'm going to put a motion out not to move it forward. Is there any
Make a mo-
second?
Can I make a
I'll second it.
Any other committee members?
Action.
Any other comments? Aileen, would you call the committee members for the vote?
Mr. Brown?
What do I have to vote to not move it forward? I
Uh,
support. I'm clarifying to make sure.
Yes, not to
The
move
yay,
forward.
not to move it forward. Yay.
Mr. Gafredo?
I want to vote on it tonight. I'm gonna vote to move it forward.
Mr. Warren?
Uh,
A yes vote is to not put it forward, a no.
no.
And
I'm not even on the. Are we supposed to be only committee members voting on this?
Only committee members. can
My
vote on
second
it.
doesn't stand then.
oh,
I was on finance too.
And then, but the motion would die with,
without a second, yeah.
so then the motion will move forward to the, then the program would move forward to the general meeting. That's the end of the agenda. Any other comments for, or questions for the, hold, there are? Where? I apologize. Sorry, Zach. Oh, I thought that was the, I apologize. Review of the Administrative Code Contract Resolution. This is for the medical consulting.
Yes, Forensic Pathology Services.
Why don't you give us a brief
Yes,
overview of what your needs are?
yes. So Forensic Pathology Services is the forensic pathologist that does what we call the gross portion of the autopsy. So that plays a very important role in our investigative process, and that is also one of the individuals who will go to court, work with the district attorney's office with the prosecution of any cases that charges are filed against an individual. So Dr. Waugh, it's pronounced H-U-A as Waugh, is a clinical and anatomical pathologist. He's board certified in that. He's board certified in forensic pathology, and he's board certified in neuropathology. In addition, he's a PhD chemist. So this individual has qualifications that far exceed most individuals in it. Throughout the United States, there are less than 500 forensic pathologists. There are even far fewer that have certifications in both forensic pathology and neuropathology. What the difference is and I mean no disrespect, a neuropathologist can do special studies on brains when we have individuals that may have very rare forms of brain injury or disease process, and that may be necessary. For that reason, years ago, when we were having difficulty with scheduling, I began to look for various forensic pathologists that were interested, and this individual I found to be very well qualified. This individual worked in the New York area and the New Jersey area, resides both in New York and New Jersey. When he began doing work for our county, he bought a house in Easton also. He felt that it was important that he be a taxpayer in this county, and does work here.
Zach, I've been very hesitant to accept one bid proposals. And when I saw it was one bid, I'm glad you're here so you can answer any concerns, but just going through, he has a 450 per hour consultation service, a 450 per hour testimonial fee, and a $2,000 autopsy fee. Are these numbers, in your experience, in line with the averages? Because I know he's from New York. I know he's worked in higher scale areas. Are these acceptable in your eyes? I know he's very good at what he does. You've made him seem exceptional. Is that what you think we should be paying for it? Is that in your professional opinion?
Yes, sir. Respectfully, his rates are actually lower than others. There were forensic pathologists that we had worked with prior, and we paid more for.
Okay, well, that's what I was hoping to hear, because I just don't want to be paying top end of the spectrum.
We're absolutely not paying that, sir. And his rates have been very consistent, and he's kept them relatively flat.
Thank you.
Any questions? Anybody else? Zach, the concern I have is, or I'll ask for clarification. The way the agreement is written, you got 2 5-year, basically evergreen terms in there. Who gets to decide? In the language of the contract, is it the is it the county that gets to decide whether or not to trigger the evergreen and allow it to roll forward, or are we able to, is it a mutual decision to exit? Can the doctor exit if he's not interested in continuing?
Yes.
Just clarification on how that would be
Absolutely. Yes, so
implemented
both parties could cancel the contract at any time.
at any time, okay?
With, a respectful notice. I would say it's very difficult finding, very high quality qualified individuals. Forensic pathologists are hard to find. You will see that there are many articles written across the country for counties and both coroners and medical examiners' offices that have problems recruiting forensic pathologists. As a result of that, it's very, very difficult. With reference to the reason why there are 2 renewals in this is, number one, to keep his interest, and hopefully he stays and is willing to continue that. But it would also be, at the renewal would be a discussion with the county executive and also purchasing, and then that's the process that has routinely occurred. With that said, I think it streamlines the process as well and keeps it consistent. One of the things that I have done historically in the past through my tenure here at the county is I've worked very closely with the district attorney's office. I began in 1992 as the coroner when D.A. Morganelli took office. Worked very closely with D.A. Morganelli, and it's important that the district attorney also feels comfortable with who is testifying as an expert in the cases that we present to the courts. And I've talked with D.A. Barata, and he is very pleased with the services that he has seen from Dr. Waugh, both as a judge and as a district attorney.
Thank you. Any other questions, comments? Thank you, Zach.
Okay, thank you very much.
All right, then, last item on the agenda, I apologize for having missed both of these. Review of Article 13, Vision Technologies, Inc.
These are the server refreshes for data recovery, for the Data Recovery Center. It's over a certain amount of money, so council must approve. Thank you.
Okay, any questions, comments? Anything else to bring before the Finance Committee at this point? We'll make a note that Mr. Kraft joined us, so if not, then we'll adjourn. Thank you.